Your liver is a vital organ in your body. If it fails, all your other organs will fail. It performs vital functions such as the breakdown and storage of crucial nutrients, detoxification of toxic substances, and strengthening your immune system. Even though 75% of your liver tissue is capable of regenerating, liver diseases are still a serious health concern and, in extreme cases, can be fatal. For example, in 2017, liver cirrhosis was responsible for around 1.32 million deaths worldwide. This represented 2.4% of all deaths globally in that year. This is why early detection is super important. If a liver disease is detected early and then combined with proper management of the condition, it can significantly diminish the severity of the condition and lead to a positive prognosis. This is why in this video we will reveal to you 12 weird and unusual signs of liver damage. We recommend you stay until the end of this video, as most people would never guess that these signs can be related to underlying liver disease. Now, without any further ado, let's get to it. Number 1. Itchy skin. Having itchy skin can be an agonizing experience for anyone. If you suffer from persistent and intense itching, with no obvious cause such as allergy, then this could indicate underlying liver damage. This itching can be either limited to a certain area in your body or throughout your whole body. But how can a deep organ like your liver have a superficial effect on your skin? Well, your liver is responsible for the metabolism of bile salts. Under normal conditions, your liver breaks down bile salts and converts them to soluble compounds that are dissolved and excreted mostly in urine. However, this process is disrupted in a diseased liver. In this case, the liver is unable to properly metabolize bile salts. So, they accumulate in the blood and deposit in the skin, causing intense itching. For temporary relief, you can use topical antihistamine creams and avoid hot showers, as they may aggravate the itchiness. Number 2. Asterixis. Try extending your wrists right now. Do you notice involuntary jerking or flapping movements of your hands? If your answer is yes, this is called asterixis. As you may know by now, your liver is responsible for the metabolism of numerous substances in your body. The main goal is to convert the metabolized substances to less toxic compounds that can be easily excreted out of the body. Sadly, when your liver is damaged, these toxic compounds aren't properly metabolized and maintain their toxic properties. One of the most toxic examples of such compounds is ammonia. Ammonia accumulates in your blood and travels to your brain. There, ammonia causes tremendous damage to your brain tissue and leads to neurological manifestations such as asterixis. Number 3. Spider angiomas. Spider angiomas are small, spider-like blood vessels visible just beneath the skin. They're commonly found on the legs, neck, upper part of the trunk, and arms. Spider angiomas have a central red spot with radiating lines surrounding it. Their presence can be attributed to increased estrogen levels. This is because estrogen causes the widening of blood vessels, which makes them more visible under the skin as more blood fills them up. Estrogen levels increase in liver dysfunction because the hormone isn't metabolized properly. The accumulation of the hormone increases its levels over time. Spider angiomas are painless. Unless you see them, you may never know they're there. Number 4. Palmar erythema. The word palmar refers to the palms of your hands, and erythema means redness and hotness. So palmar erythema is a medical term that refers to the reddening of the palms, often more pronounced around the base of the thumb and little finger. This is another indicator of liver damage that also occurs due to high levels of estrogen, just like spider angiomas. Number 5. Fetor hepaticus. Have you been experiencing stinky breath lately? Does it feel that no matter what you do, the smell still persists? This may be because you're using external methods to try to fix the problem while its source is internal. Fetor hepaticus is described as having a musty breath that smells similar to raw fish or garlic. The cause of this smell is sulfur-containing compounds. In the case of liver damage, the liver becomes unable to properly metabolize these sulfur-containing compounds. Having good oral hygiene and mouthwashes can help mask the odor temporarily, but you still need to address the internal issue in your liver. Number 6. White nails. If your nails look white with a ground glass appearance, you may want to get your liver checked by a doctor. Moreover, you may also notice a red or pink band at the tips of your nails. The whitening of your nails can occur due to low levels of a protein called albumin in your blood. Normally, this protein is synthesized by the liver. However, in case of liver damage, albumin production decreases. Number 7. Clubbing of fingers. Unfortunately, clubbing fingers isn't as fun as it sounds. Clubbing of fingers is when your fingers and toes swell. They'll have a bulbous appearance, and your nails will show a downward curve and an abnormal shiny look. This abnormal appearance of your fingers is an obvious sign for underlying liver disease. One of the main causes for clubbing of fingers is low oxygen levels in blood. Liver disease can affect lung function and blood flow, which consequently reduces oxygen levels. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 8. Gynecomastia. Gynecomastia refers to the enlargement of breast tissue in men. You may feel pain only upon touch and swelling of the breast. As we mentioned before, your liver is essential for metabolizing hormones, including estrogen. Liver damage can impair this process, leading to elevated estrogen levels in men. Sometimes the enlargement affects only one breast. Furthermore, it may take the form of lumps instead of affecting the whole breast. In mild cases, hormonal treatment may help reverse this condition. However, in severe cases, surgical removal of excess breast tissue may be required. Number 9. Dupuytren's contracture. Dupuytren's contracture refers to the inward bending of fingers due to the thickening and tightening of tissue under the skin of the palm. While the mechanism of this condition remains unknown until today, Dupuytren's contracture has been linked to liver diseases. Number 10. Xanthelasmas. Xanthelasmas are seen as deposits of fat under the skin, often around the eyes. Because of the fat, these deposits have a yellow color. These deposits may be flat or slightly raised above the skin surface. This condition occurs due to disorders in the metabolism of fats due to liver dysfunction. In response, there's elevated cholesterol and triglyceride levels which precipitate all over the body. Number 11. Dark urine. Dark urine is an alarming sign of probable liver damage. This is due to the excretion of bilirubin in urine, instead of being metabolized by the liver. Bilirubin is the product of the breakdown of hemoglobin inside old red blood cells in your body. A healthy liver should be able to metabolize bilirubin and excrete it in the intestine, where it'll eventually be expelled out of the body with stool. But in case of liver defect, excessive bilirubin in urine will give it a dark tea or cola color. Number 12. Clay-colored stools. A paler than usual stool that is gray or clay-colored should make you question your liver health. This unusual appearance is due to the lack of bile salts in stool. Bile salts are released by your liver into your intestines to help with the digestion of fats. After they complete their function, bile salts pass through the digestive tract and are excreted in stool. This gives the stool its brown color. However, liver diseases can lead to obstruction of the bile ducts, which are the pathway by which bile salts reach the intestine. Adding to that, a damaged liver may produce less bile, which will cause stool to be lighter in color. So, these were the top 12 weird and unusual signs of liver damage. Recognizing these symptoms can help you in the early detection and treatment of liver diseases. Now, we want to hear from you. Have you or anyone you know ever experienced any of these signs? Would you have ever guessed they indicate liver damage? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.